before the last session kind of kicked me out during the recording, I was reading the sentence, "Do you think this could have been prevented?" And this is to deal with students who are displaying some heavy sense of self-guilt or responsibility for what may have happened. And this sense of self-guilt may not go away quickly. But as you engage them with conversation and they start to rationalize the scenario and understand that they're not in control of many of the circumstances of what occurred, they will come around, and that self-guilt should subside. Finally, a very helpful tool to use when working with students in crisis is scaling questions. These can be used to gain a sense of where a student currently is emotionally, where they would like to be, and as a springboard for discussions on how they might get there. I'm going to go ahead and show you an example of an illustrated scaling question in just a second. It is important to draw it out so that students aren't forced to rely solely on their mind's eye or inward cognition or trying to imagine what this might look like when they're answering the questions. So the visual aspect of this tool helps both me, the crisis responder, and the student when providing levels of emotion. The question might sound something like, on a scale from 0 to 10, 10 being not at all distraught and 0 being over the top, like you've never felt before, where do you currently rank yourself? And the student might respond by pointing only or pointing and verbalizing, well, I'm probably at a 3. And your response might sound something like, okay, a 3. Well, that's definitely kind of on the low end, huh? And they may nod with acknowledgement. Then you would ask, where do you want to be on this scale? Students usually answer with a number that's far further up the scale because they are there in that room with you for a reason, and that's to want to get help. However, there are rare occasions where they'll answer something lower or something only slightly higher than the 3. But for the sake of this example, let's go with the norm and suppose the student answers with a significantly higher number, like 8. The crisis responder might then point out that it's very encouraging for them to hear that the student wants to be at an 8. They obviously want to make improvement. And so they're in a point in their minds where they're encouraged and they're eager to move forward. The crisis responder might then ask the student, well, how do you suppose we work together? Or say something like, I'm wondering what we can do to get from a 3 to an 8. Let's say the student responds with something like, I don't know, it feels pretty impossible right now. The responder would then emphasize that perhaps going straight from a 3 to an 8 is a little bit overwhelming, maybe a little hard to swallow, but then maybe there are some smaller things we can put into place to bring the student from maybe a 3 to the 4. Then, once at a 4, from a 4 to a 5, and so forth. So, the whole analogy of throwing a tiny pebble into a pond, albeit a tiny pebble, creates ripples that reach pretty darn far. And if you can get us just baby stepping up to the next number on the scale, then we're making question things can head used for any type of emotionally based question or answering system. I find it especially useful if a student is saying that they really feel like they're going to harm themselves, or if they're having suicidal thoughts. You might ask something like, well, on a scale from 0 to 10, 10 being you really you have a plan and you're going to kill yourself later, or 0 being I feel fantastic and happy, just as though nothing has ever happened bad in my life. Where they answer will determine whether or not you go and get help. And it's always important, though, to understand that sometimes students will feed you a line and not tell you the truth. But if they were to answer high on the scale as though that they would like to harm themselves, then you would ask them, well, where do you want to be? And this tells you, a little bit about whether or not they're just thinking about suicide or if they're really planning on doing it. At any rate, when a student, as we mentioned before, when a student says anything about suicide, you definitely want to discuss this with a campus administrator, school psychologist, or school counselor. I'd also like to mention before we move on to the next slide that I advise you to reference the rest of the questions in the crisis interview handout, which of course you can find on the Kerrville Ministerial Alliance Resources website that was established. There are many files on there. It's pretty intuitive, so you can dig that up if you haven't already printed it out. We're now going to briefly go through the 3 overlapping components of our KISD crisis response model: stabilization, normalization, and adaptation. The reason I say briefly is because there will be different sessions where we go into greater detail regarding these 3 components. So remember that the purpose of this introductory module is to provide you with a broad overview familiarizing you with the concepts. We'll be discussing these three components in greater detail further into your crisis response training. So as a KISD ministerial crisis responder, you're essentially providing spiritual first aid. Whether or not you actually pray or discuss spirituality with a student does not change that fact. Upon embarking on an initial meeting with a student in crisis, it's to work to help them stabilize. That's your primary goal. The student may be unstable when they are notably outwardly upset, if they're fearful, they're frantic, extremely sullen, lethargic, or they appear confused or lost. Many of us have worked with kids long enough and other adults long enough to be able to read their body language. If you're at all concerned, you definitely want to work to stabilize. We'll talk about how to do that. So there's a broad range of how a student might be responding when they're in the stage, I guess, or the component of stabilization. That's our goal. So it can be extreme, it can be less, impactful or less, outward, or it can be more inward. So it's important to kind of get a good gauge of where the students are at. Crisis responders can follow the simple guidelines up here to help bring the students to the moment, or, in other words, become cognitively stable or reasonable. And it doesn't have to be perfect, like where we are. If we're making improvement, that's a good thing. So first and foremost, be present in that moment as a responder. During a crisis situation, many students are overwhelmed with what just happened, or they're speculating or thinking about what might happen next, driving up their anxiety and fears. It would be a huge mistake for us as responders to match them in that regard. We're the stable ones. We can only bring the students to the moment if we ourselves are focused on that moment. This means focusing our energy towards a student or group that's present there, being present in the moment, and not concerning ourselves with who might be coming in next after these students are finished, or when we might grab dinner later that evening. The normalization stage of crisis response is dually defined. Normalization of emotions and feelings as they pertain to the student's perception of self and others is one definition. A second and equally important definition is the normalization of life routine and schedule, or the importance of helping a student to get back to their normal routine, which is oftentimes predictable and a good way of reducing fears and the tendency to dwell on circumstances. In other words, our job is to help move students from stewing to doing.